For the assessment, determine the client's ability to tolerate the therapy, and then identify conditions that might contraindicate treatment. Assess the skin area to which the heat and cold will be applied. Then assess the report of discomfort. Lastly, observe the local skin area for any untoward signs and examine the area to which the heat or cold was applied. And for the planning, wash hands, and then assemble all materials and equipment. For the implementation, check the temperature of water with bath thermometer or test on the inner wrist. Then rinse bag with water, empty and then fill. Then fill hot water, bag 1/2 to 2/3 full. Expel remaining airbag from one of two ways. Place the bag on a flat surface. Permit the water to come to the opening and then close the bag, or hold the bag up, twist unfilled portion to remove the air, and then close the bag. Then fasten top securely. Check for leaks. Then cover bag with towel or other protector and apply hot water bottle to prescribed area. Assess condition of skin and clients respond to heat at frequent intervals. Do not exceed prescribed length of time for application of heat. Remove hot water bag if excessive swelling, redness, or pain occurs and report to the physician. And dispose of equipment appropriately and wash your hands. For the evaluation, evaluate client's response to the treatment. And for the documentation, record the size, location, and appearance of treatment area, status of pain, duration of treatment, and client tolerance to treatment. For the assessment, determine the client's ability to tolerate the therapy. Then identify conditions that might contraindicate treatment and assess the skin area to which the heat and cold will be applied. Assess the report of discomfort. Observe the local skin area for untoward signs. Examine the area to which will be the heat or cold will be applied. For the planning, wash hands, assemble all materials and equipment. And for the implementation, explain the procedure to the client. Screen of unit if location of treatment makes unnecessary exposure of patient. Protect bed area with rubber sheet under the part of the body in which a compress is to be applied, and then wash hands. Soak the compress into the basin with hot water. After that, take all necessary equipment at bedside. Wring out excess solution from the compress. May use the forceps in doing so. Then apply hot compress to affect part. Watch skin carefully signs of scalding. Repeat steps 13, 15, and 16 every 1 to 2 minutes for 20 minutes as ordered by the physician. Then dry area gently. And lastly, remove the rubber sheet. Leave patient dry and comfortable. Do the aftercare of materials. And for the evaluation, evaluate client's response to the treatment. And for the documentation, chart the following date and time of treatment, response and area of application, duration and reaction if any effect, and signature of the nurse, actually my signature. So for the assessment, treatment order and client's response to previous treatment, if used, condition and appearance of treatment area, edema, local bleeding, and lastly, status of pain. For the planning, wash hands and assemble all materials and equipment. For the implementation, fill the bag with small pieces of ice to about 2/3 full. Then remove the air from the ice bag, same as manner of removing air from the water bag. Then secure the cap. Test the ice for bag leaks. And then place cloth cover on the ice bag. And apply on ice bag for only 1/2 to 1 hour and remove for about an hour before reapplying it. To discontinue, do the same aftercare with that in the hot water bag application. And then for the evaluation, evaluate client's response to the treatment. And lastly, the documentation, size, location and appearance of the treatment area, and status of pain, duration of treatment, client tolerance to treatment. For the assessment, check doctor's order for specific of treatment. Assess client's knowledge of the benefits of sitz bath. Baseline vital signs, appearance and condition of treatment area, client's knowledge of benefits of sitz bath, client's inability to remain unattended in bathtub, and status of pain. For the planning, wash hands and assemble materials needed. For the implementation, identify the client, explain procedure to the client, and then wash hands. And organize equipment and don gloves. Then check the temperature of water with thermometer of 40.5 Celsius to 43 Celsius. If the thermometer is unavailable, test water with your wrist. Water should be warm. And place rubber ring at bottom of tub and bath mat on floor. Close the door and assist client with undressing. Assist client into tub using footstool if necessary. Sit client on the rubber ring, ascertain client's stability in the tub alone and assess reaction to the heat. Observe facial expression and body motions for sign and discomfort. Ask if heat is too high. Watch for dizziness, faintness, profuse diaphoresis. Note any rapid increase or irregularity of pulse. Then instruct client on use of call light and place light within reach. Recheck client every 5 to 10 minutes. After 15 to 20 minutes, help client out of the tub and assist client with drying and dressing, then place linens in hamper. Return client to room or bed. Then remove equipment and clean tub. Then lastly remove gloves and wash hands. And for the evaluation, evaluate client's response to the treatment. For the documentation, appearance of treatment area before and after treatment. Any unusual reactions to treatment such as profuse diaphoresis, faintness, dizziness, palpitations or pulse changes. Durations of sitz bath and status of pain.